My name is James Hospedales. I'm the Executive Director of the Caribbean Public Health Agency.
Is there a doctor in front of you?
There is. I'm a physician, a specialist in public health. The hub fits by supporting us to confront the second biggest cause of death in the Caribbean region, which is cancer. And when you look at our death rates from cancer, especially cancer of the breast, cancer of the cervix, cancer of the colon, we are multiple times higher than North America or Puerto Rico. That inspires us to say, well, why is that so? And the Cancer Registry Hub is critical to understand the beast we're dealing with, to have better data and better information to prevent and control the disease. I mentioned we have a big problem, and it's growing. It's growing because the population is aging and cancer tends to be associated with older age. It's growing because we have a lot of risk factors in the population: smoking, obesity. Obesity is a major driver of cancer. Colorectal cancer, breast cancer in women. People often don't know that. People know the connection between smoking and cancer. Drinking, high levels of alcohol, men and women. Drinking is a risk factor for cancer, especially stomach and all the bladder and so on. So you have behaviors in the population. You have an aging population where cancer is becoming more and more important. And the costs of it are tremendous. Some of the good drugs that do work, they cost a lot of money. All of that says we must have better information to understand the size of the problem, what treatment is working, not working, to be able to advise governments, advise the ministries of health and the practitioners, so we can better prevent and control this major health problem that we have.
I want to piggyback on to the topic of advising the governments following once the data has been collected. Now, let's say that the hub is up and running, data is coming in, and you've issued advisories to governments. Would you then be following up to make sure that these advisories are followed?
Yes, because CARPHA is comprised of the 24 member states. We work closely with all the chief medical officers, such as occurs in this annual meeting. We work with the WHO, we work with some of the NGOs in the country. So that follow-up is there. One of the strengths of this Cancer Registry Hub, there are 6 of them globally, one of the strengths of this one is by locating it in CARPHA, you're able to collect data and you're immediately able to analyze, process, and put that into policy briefs, put that to the chief medical officers, get agreements, and then get agreements also to the monitoring and follow-up that year by year we're going to be checking. And so that's the general framework of how we will be moving forward with this.
Thank you very much.